y'all, it's your girl Nurse Ebony, and in today's video I am going to be showing you guys what is in my clinical bag. But before we get into that, make sure y'all like, comment, subscribe, and hit that notification bell while you're there so you don't miss another melanin drop. Alright, let's get into the video. Alright y'all, so I have a few things that I do not use at every clinical. I bought it at the beginning of nursing school, not really thinking about the fact that I probably wouldn't need it because the hospital was going to supply all of things. Can't talk. The hospital supplies most of these things. But I'm going to show it to you guys anyway because you might work at a hospital that does not supply these things and you might need it, you know? So let's get into it. So I got this off of Amazon. It says health on it. And then you open it up. When you first open it up, it looks like this. Okay, so there's two pockets. And then I have some stuff in here. So I have my thermometer. Pretty much you just turn it on and then put the patient's finger into here. And it tells you guys the patient's heart rate, and it tells you guys the patient's oxygen saturation. My school gave us these scissors, medical scissors, and I have this blood pressure cuff that my school provided. It is an average adult size, so the standard blood pressure cuff, just in case we have to manually take blood pressure. Usually I'm in the hospital, so in the hospital the patient has their own separate blood pressure cuff that we use, and then we just set it up to the machine, press this easy button, and it does it for us. However, you have to learn how to manually take blood pressure, and you have to carry the manual blood pressure cuff just in case there aren't any machines around or available for you to use. You can always take the manual blood pressure with that cuff. And of course, you guys, I have my stethoscope and I have my watch. On this watch, I can track how many steps I did, how many calories I burnt, how many miles that I walked. Okay, so they do have hand sanitizer inside of the patient's room and outside the patient's room, depending on where you work. In most hospitals, they do have that, but I like to keep my personal hand sanitizer. So I will go to Bath and Body Works and I just kind of pick up like a bunch of different hand sanitizers. This is my favorite one. It's Hibiscus Paradise. You guys, so, and oh my gosh, it just smells so good, you guys. And your girl keeps some Victoria's Secret lotion. This is the Neon Lily Victoria's Secret lotion, and this smells so good. My babe got it for me. Thank you, babe. It smells so good, and I keep it with me because, you guys, I'm hand sanitizing my hands all day, every day, and your girl needs lotion, so this is in my clinical bag. On the floor, we have to wear goggles. I'm pretty sure you guys have seen these goggles in my week in the life of a nursing student video. If you have not seen these goggles, go watch that video and you guys will see me charting with these big old goggles on my head. I had this nursing tools belt that kind of holds everything that I need in here, but in some hospitals, because of infection control, things like that, you are not allowed to have this. That's why I carry both this and this, depending on the hospital that I'm working at. It depends if I can have this out or not, but this just attaches to my waist, you guys. Let me show you guys. As you guys can see, this just attaches to my waist, and it makes it super easy to take my patient's vital signs and do the head to toe because it's right there on my waist. and easy to grab, and it just like makes it so much more convenient. I don't know. It works for me. So this kind of just holds my ID. I like it because it's the retractable one and it clips right there in the back. So it makes it really easy for me to just pull and then go into, you know, the medicine room or the nutrition room in the hospital. It makes it really easy for me, so I like that. I have this calculator. It's just a simple mini calculator that my school provided for me. I like to use this calculator when I'm like looking at the medicine dosage, especially in pediatrics, because everything is weight based and you need to give your patient the right amount because you do not want to mess that up. So I like to carry this simple little mini calculator. And just make sure that the medicine amount is correct. I showed you guys the scissors that my school provided for me, but these big bad boys I bought myself off of Amazon. You guys, most of the stuff is from Amazon. Unless I say this is not from Amazon, it's mostly from Amazon, or my school provided it for me. I love these. Like, these are literally the best scissors that I've probably ever had. I know they're just scissors, but like medical scissors are really important to me, at least. And yeah, so these, oh my gosh, and they look so pretty. Oh my gosh, I'm in love with these scissors. Does anyone else get excited about nursing tools? Like, I'm that person. So I got this little baby from Dollar Tree. I got this because it's easy to fit into my pocket, so I don't have to go into the patient's room carrying a large clipboard every time. I can just have this, and it's easy and convenient to just fit into my pocket when I take their vital signs. This is my pen light, okay? It has the pupil, I don't know, gauge on the side right there to check my patient's eyes. So that's what this light is for. Okay guys, and this is my Pro Round Medical Rounds notebook. It looks like this, and it looks like, ooh, this is the page when you first open it. You put all your patient information here. To be honest, I bought this book and then I never used it, which is crazy because this book was like 30 bucks. I'll probably use this book when I am, you know, in my nursing practice. But right now, my school provides all of the paperwork that we really need, so I don't have to carry this book. If your school doesn't provide you with paperwork, I highly recommend this book because everything that you need is in this book, you guys. This is the paper that I write all of my patients' medications on. You guys, I use the Davis Drug Guide for Nurses app. I highly recommend getting the Davis Drug Guide for Nurses app. Even if you are not a nurse, it is helpful, okay? So get the app. It's like $35 for the entire year, and it'll tell you every single thing you need to know about that medication. So go get it. And this video is not sponsored, okay? So I use the nursing diagnosis. So I use the nursing diagnosis handbook. I use that to fill out my concept maps. On the concept map, I put areas for teaching, signs and symptoms, medications, treatment, body system affected, independent nursing assessment, all of that good stuff. Last but not least, I have the clipboard. Okay, you guys, this clipboard is my best friend. It is a cheat sheet to everything that I need to know. Like I said, I am that person that gets excited about any medical tools. So yeah, I love this clipboard. If you watch the week in the life of a nursing student video, you will see that I use this clipboard every single time that I am on the floor. So I highly recommend this clipboard. I got it from Amazon for like 30 bucks. That concludes this video, you guys. Thanks for watching this video. Make sure you like, comment, subscribe, and hit that notification bell while you're there so you don't miss another melanin drop. See you guys in the next video.